Yeah, we spent a whole hour on a topic that I thought, well, it'll take 10 minutes, and then we'll have to talk about other kinds of OCD the rest of the time. But we did the whole thing on hoarding.
Yep.
And you gave me some tremendous insights.
Well, it's just
of course they don't have energy to do that. Yeah.
Yeah.
I thought, well, no, why don't they do that? Is it symbolic of they want dirt, or does the dirt represent sin, or does it represent, and it just represents that they don't have the energy to do that because they're spending it doing other stuff.
Exactly.
Think of somebody today or tomorrow that you can encourage, or you can say something nice for, or even do something nice for without them even knowing it.
Absolutely.
That makes you feel good too.
Welcome to the Meier Clinics podcast. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meier Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us.
Hi, everyone. Thanks for joining us. I've got Dr. Paul Meier, our favorite guest, on with me to talk about a topic that it's becoming more mainstream to talk about, but it's done with, I think, a lot of insensitivity and ridicule, some of the shows that get done about it. But the topic is hoarding. And Paul, thanks so much for wanting to talk about this and bringing it up with me.
Yeah, because we've done, I don't know how many programs now.
A lot.
Probably a couple hundred or something like that, 150, 200. And I don't think we've ever done one on hoarding. And I had a neighbor ask about it recently. Is it genetic? Is it psychological? Is it due to this? Is it due to that? And the answer was all of the above. But a lot of the cases, and I've seen a lot of cases of it, and like you say, it usually is secretive. I've had patients that had it for a couple of years or 3 years before they told me, and because they didn't even tell their psychiatrist. But I think for people that I think for most genetics a big component. Let's just put it that way. I hate to put a percentage on different ones, but just like any kind of, it's a type of OCD. So people that are obsessive compulsive, meaning people that always have to count things and super organize things and check the doors 4 times a night and have rituals and obsessions and things like that. People that have that from birth on, it's genetic. People that don't have it all their lives, and then after a crisis or abuse or that have a car wreck and their family dies or something, will have it for a while as part of their OCD. As part of their PTSD.
Right.
And then 1% of the population becomes schizophrenic in their 20s, teens or 20s, and they become, a lot of those become OCD for a few months before they become psychotic. Or 1 out of 33 people get so depressed at one time or another that they become temporarily psychotic, even after the birth of a baby or something. It's, it can happen, and they often become OCD for a while. And therapy can cure those kinds of OCD, but the kind that you're born with, people that are born with OCD and have that their whole lives, and hoarding becomes a part of it, then I really don't think, I think they could have counseling for 20 years and not they might improve a little, but they won't get over it. But they can get on the double dose of the serotonin medicine and be over it in 4 to 8 weeks.
And yet not one of
that's shocking to them. That's shocking,
Yeah,
people that hoard because they think, no, it can't be that simple.
Oh, Paul, when you see people who, like you're talking about, have had this for so long, they're born with this has been going on forever, and then they they do stay on medication, because we both know that that's part of the difficult journey, is getting them to stay on medication.
Getting them to even get on medicine.
Yeah, I mean, what do they do with the time that they're not spending on this activity? Because it takes up a huge chunk of their mental and emotional and physical, amount of time in their lives. And without that, where does that go?
Okay, and for this podcast that we're doing right now, I pulled up a couple of case studies of people that I've seen for many, many years, but I'm disguising enough of the information so that I know them so well for so many years. One of them for over 20 years, that they wouldn't care if I did it. They wouldn't care if I gave their names and stuff. But still, I'm going to disguise them enough so that I don't want to embarrass anybody. But so let's say one of them is a 54-year-old female, and she's real successful at work. At her work, she's well liked. Nobody knows that she has OCD or that she has hoarding, and she's 54 and still single, even though she's attractive and intelligent and is normal when she's out mixing in society. But then she comes home, and she's got a little apartment that's less than 1,000 square feet, and in her apartment, she's got so much junk that when she has to climb over things to get to her easy chair to watch television, and if she has to get up to go to the bathroom, she has to crawl over things, the junk, to get to the bathroom, to go to the bathroom. She, not only that, but she, I guess I can say, she never washes her underclothes, but she wears clean underclothes every day because she just buys tons.
Right.
So she wears new underwear every day and new underclothes, and she just spends a lot of money. And I guess she gets it at Amazon or something. Gets it fairly cheap, but she doesn't throw away the dirty. She lets it just pile up somewhere, and she hasn't washed, or before I treated her, she hadn't washed her dishes for a couple of years, and occasionally she'd have to clean enough so there wouldn't be insects and things growing out. Right. But she would just let them stack up, and either buy more or eat off paper plates mostly. And but people would never guess that. In fact, I saw her for depression, and I didn't even know she had OCD at first because she hid it so well. And she didn't tell me about any of this stuff. And I didn't know. I looked back over her whole record this morning earlier, and I didn't know she had OCD until I'd seen her for over a year. Because she just she'd say no to those questions that I asked. I didn't know she hoarded until about 2 years after I started seeing her, and she finally admitted it when she trusted me enough. And to get somebody over hoarding, when it's genetic, which I think in most cases it is, or at least it's either totally genetic or partially genetic, most of the time, but sometimes it's not. But anyway, now her mother is schizophrenic, so even though she's not schizophrenic, because her mom is, you would think that a dopamine medicine, which helps cure schizophrenia, would probably help, and it ended up helping. But it's primarily a serotonin problem, and you and I have talked about serotonin a lot. Serotonin is the chemical in our brain that gives us love, joy, peace, patience, good sleep, and when it's low, not only do we get depressed more easily, but we get more self-critical and perfectionistic, and we develop obsessive tendencies if it gets low enough. And to treat somebody with OCD, some psychiatrists don't even know this, and just from their training. Unless I've been practicing 45 years, so a lot of the stuff I've learned, I've just learned from experience. But if I put them on any antidepressant, like Pristique or Prozac, Zoloft, any serotonin-related antidepressant at double the normal dose, the OCD usually goes away. or it gets so minimal that if I add a dopamine medicine, the dopamine medicines are what we use for schizophrenia, but we also use it for perfectionism. We use it for anxiety. We use them for a lot of things. So just because your doctor has you on a typical antipsychotic agent doesn't mean he thinks you're psychotic. He probably doesn't. But
Right.
but I knew that combination, when I found out the truth, and I did know about her childhood and all that, so I really knew that combination would work. But it took me probably 2 more years to talk her into taking them. So she'd take
Right.
she would spend $200 a month on junk from the health food store, St. John's wort and things that didn't do any good. And and I just patiently kept seeing her, and she would take a tiny little bit of something. And when you give somebody with that's a hoarder or any kind of OCD, when you give them a medication, they have side effects to everything because they're so afraid of taking a medicine. And they feel like, they always tell me that they feel like if they take a medication, they'll lose control. They think the medicine will control them. And I explain to them over and over again, I say, it gives you control. Your low serotonin, like Kristin, if somebody injected me and you with something that made our serotonin real low, we would start hoarding and obsessive, and rechecking the doors 4 times a night and get self-critical and get depressed. And the chemicals would make us different than we normally are. And so somebody that inherits a low serotonin level, when they get on an antidepressant serotonin medicine, then what they're like after a couple months on the right dose of the right one for them, that's the real them. I tell them, John, meet John,
I know, and I very, very, little interjection here. Just doesn't have anything to do with hoarding, but as an example, obviously I'm someone who, believes in taking medication, better living through pharmacology. I mean, all kinds of things, and yet I've had my own struggles with staying on my medication. So just recently I moved, and it was a big ordeal, and blah blah blah. But I lost my bottle of Prestige, and I take 50 milligrams a day, so this is not a huge amount. But I
do too.
Genetically, yeah, exactly. We take some similar medication.
Yeah.
So, and I know genetically, because I've had those tests done, that this is something I was born with. So for 2 weeks, I couldn't find my medication, and the way that I get it, I have it mailed to me through this pharmacy, and it wasn't going to come for 2 weeks. And I'll tell you what.
Hi, this is Dr. Paul Meier of the Meier Clinics. Our Christian counselors across the country have a goal of helping all those who come to us to become what God has called them to be. If you're in a situation where you're not at peace within yourself, or you just feel like there's joy that's missing in your life, we can come alongside to help you obtain peace and joy.
This message is sponsored by the Meier Clinic Foundation, a nonprofit Christian counseling ministry. The number is 1-888-7-CLINIC, 1-888-7-CLINIC.
You should have called me. You should have called me, because you can go buy it. You can go buy it with a GoodRx card and just pay cash for it and get it for like $25-$30 for a month supply.
I know now, finally. But you're caught up in all these other things. But I noticed, it's interesting when you know these things and you know yourself so well and you know your body. My body doesn't pump out enough of it. That's just the way the cards were dealt for me. And so I did all those.
So what happened? How did you feel?
Obsessive. I was obsessive. I was negative, everything against me. People are saying, and I was obsessive about information and about people's behavior. I tend to go that direction. And then like the day that it arrived, and I don't know if this is true or if it's just because I was so happy that it arrived, I know that I need to take 2 days or 3 days of double the dose and then go back to the regular, because that's how I've done this how many times. And it was like the sun started shining, and it wasn't like, ooh, I'm la la fairyland. It was like how I normally am.
Yeah. And that wasn't the real you that was doing those other things. That was you or anybody else that inherited somewhat of a low serotonin level that's not taking care of it. And the real you, I know the real you, and the real you is, the kinder, gentler, loving person that I've known for all these years. And I tell people, and I like to give a little bit gross illustrations here on your podcast so that you get in trouble and all that. But if you need a serotonin medicine, you don't take it. It's like if you have a pet, like you've got a dog, it's like putting dog crap on your glasses. And you look at life, and life does have tough things that we all deal with. But if you have dog crap on your glasses, things look even crappier than they are,
Exactly.
And so you look crappier to yourself, and I'm not talking about physically, but emotionally. We get mad at ourselves more, and no matter what we do, it's not good enough, and we get mad at people around us, and we get more depressed because depression's anger turned inward, and we get more obsessive, compulsive, and things like that.
Self-talk is horrible. Like I would walk by myself in a mirror and go, look what you've done to yourself. My God, just all these things. You're getting older, just every possible negative thing. Nothing that someone could say isn't true, but when on medication, I don't do those things. I look at the glass half full, not the glass half empty. So
and for some reason, it's universal. I'm not sure why it is that way, but for some reason, almost every single person that I see for hoarding or any kind of OCD is scared to death to take a medicine. Like I said, they'll go buy junk at a health food store and spend $200 a month on it, but they won't spend $4 a month on Prozac. That's been out for 30 years, and the normal dose of Prozac is 20 milligrams a day, or sometimes 40. But to get over OCD, sometimes they'll finally tell their family doctor, and he'll put them on 10 milligrams or 20 of Prozac, and it won't do any good. And because he or she doesn't know that to get over OCD, that person needs like 40, 60, or even 80 milligrams a day of Prozac. So if they get 60 milligrams of Prozac, then 4 to 6 weeks later, they'll automatically quit hoarding. They'll want to clean up. They might have some things they do just by habit, but in the OCD, if they have OCD, and like, I don't know if you've ever seen the TV show Monk, the detective that's got severe OCD. I see that. I love to watch that program, but at the same time, just think, if I saw Monk, here he goes to see that psychiatrist that does therapy on him for years after years after years, 4 days a week. If I saw him, I could put him on 60 milligrams of Prozac, have him come back in 6 weeks, and he'd be over it. He wouldn't need therapy.
Right.
You know what I mean?
So
you get a misperception.
And so they don't need somewhere to put that energy because because they're on medication. So they're okay. Got it.
Yeah, and I'm not saying they don't need therapy. Because if they've lived a life like this gal that I've been talking about, then now that she's finally taking the right dose of the right medicine after all these years, she's getting more and more normal, and she already is normal outside. You know what I mean? It's just those weird traits. But she was one, like almost all my people that I treat with OCD or hoarding, that is scared to death of medicine. And she had a side effect on every single thing that I tried to give her. And so I would give her a medicine and tell her, for the first 4 days, I just want you to lick the tablet. Just lick it. And and she would have side effects by licking it, just because of her fear. And then when she quit getting side effects by licking it, then I had her take a nibble of it, like, if it's a 20 milligram tablet, take 2 milligrams and take that until the side effects are gone. And there weren't any side effects. I've had people before. I don't do this anymore, but when I was in my training at Duke, sometimes if we had somebody like that, we'd give them an empty pill and tell them it was an antidepressant, and they would have all sorts of side effects to the empty pill. And then we explain to them, you're taking nothing, and so you're not faking it. It's just that your body is so scared of being controlled by medicine that you're having all this fear that's causing anxiety, and you think it's the medicine doing it, and so then we'd have them take a little bit and work their way up. Anyway, she finally did get on medicine, and what's weird is that when I finally talked her into it, and that was I look back, that was in 2018. She started trying them and had side effects to every single one, and it took till about 2020 for her to, and I just understand. I'm patient with them. I love people with OCD. They're really nice people, but I love treating it. And so you have to be a patient doctor. So about in 2020, finally, she started taking the right medication, and including a little bit of antipsychotic medicine, even though she wasn't psychotic, but because her mom was schizophrenic, she might have some tendencies toward it, that are contributing to the OCD. And so I finally had her take a little bit at a time and work her way up. And so she took a low dose and felt a lot better and did a lot less hoarding. But she didn't want to get all the way well. So it took another year of being partially cured of it to finally try a little bit more and getting 75% cured of it. And then part of her wanted to go back, and she got off her meds again because she missed the hoarding and missed the OCD. I know that doesn't make any sense, but they actually miss it. And then she finally got on the meds, and she's been normal for about a year now.
What do you think the psychological component of missing it is about?
I don't know. I mean, it doesn't. I guess you get so used to it that it's your companion or something. If you have it all your life, see, like she did, she had it since birth. And so, I mean, she would save a certain kind of toy or line them up perpendicular or different things and stuff like that.
You know what I wonder? 2-year-old. What I wonder about that, because I feel that myself about things. Obviously it's a form of self-sabotage, but I always think if you were running on all cylinders, what you're missing, because I had this great therapist that would say to me, as I'm doing these self-destructive things, she'd say, okay, but what's the pony in this for you? And I felt like when I've come off medication, not this last time, that was absolutely, it was lost, but other times it's been like, oh, now I don't have excuses anymore for why I don't do this or that, or why I'm not fully active and a part of my own life.
That makes sense.
So I want to go back to where I have this excuse because I'm ill. So and you also feel the judgment of it when you're drowning in your depression, your OCD, your hoarding, whatever it is. You are so focused on that experience that it's scary. It's like someone who's never been in the ocean is plunged in to go scuba diving, and they're like, "Oh my God, this is what's under the water." That's what normal feels like when you're taking all your meds. And like, I don't know how to behave in this land.
Yeah,
because I don't.
That's
I've never
exactly
lived
right.
Here.
Yeah, and I know you. I know you're a perfectionist, and I'm always. You're helping me with just as many things as I'm. It's not like I'm the psychiatrist that's helping my friend Kristin. My friend Kristin helps the psychiatrist a lot more than this psychiatrist helps my friend Kristin. But I know that one thing I harp at you for is you're such a responsible person that you want to help everybody, and you can't help everybody, and somebody will want to start up a podcast, and you'll probably pay for them to do it. Sometimes you really care about people, especially if they're doing a good cause, and so you overly commit sometimes, and so sometimes I have to encourage you. Hey, slow down. You don't have to do good for everybody. And so I guess if you had OCD or hoarding or something like that, it would be an excuse where you wouldn't feel guilty for turning it down because you were just too busy. And now what you need to do is that now that you don't have any OCD, then you need to get off your case and still take care of yourself. Time to have fun and not do too much.
Yeah.
And another thing that you brought up, another thing you just brought up that made me that I think is accurate is that when you are obsessing about ridiculous things, like this lady, like I said, what she obsessed and hoarded. I've got a male patient that hoards boxes, empty boxes, or he did, and he had his whole garage full of them, and he's otherwise really nice and normal and everything, and married and kids, and his wife just put up with it because she loves him, So they just parked their car out in the driveway and let the garage be full of boxes. But they hoard different things. But when they're so busy hoarding, they don't have time to get in touch with feelings. And so I think part of it is to avoid looking at painful feelings that they have inside.
Absolutely. Absolutely. I know another topic we haven't talked about, which I think would be great for a show, and I promise there's a tie-in here to hoarding, but people that are conspiracy theorists, because to me, that is
people that are what?
Hoard.
People that are what?
Conspiracy theorists.
Oh, yeah. That can be an obsessive trait.
Yes, and that can be, to me, it's information hoarding, because I've seen people who, and if Duke University's whole psychiatric program is laughing at me for making this leap, I apologize. But when I've watched this, now that I'm working more with the public and with what's going on, which we won't get into, but I've watched this need to hoard information. And while telling you, I don't watch the news. Like I've had somebody say to me, I don't watch the news.
I used to, but I don't now. Today. For the last year, I've minimized it. It's too painful.
Yeah, it is. And that's a normal response to what we've all been dealing with. But someone who will say that, but then they're reading all this other garbage going on YouTube, putting newspaper clippings up on the wall, saving thousands of folders on their computer with all this information. And to me, I'm like, that is another. To me, it's digital hoarding.
Well, for years, the most common thing that people would save when they hoarded was magazines, books, articles. Obsessives, people who are obsessive compulsive, want to know everything. They do want to know everything. Yeah. And so whenever they'd get a newspaper, you don't have time to read the whole newspaper, but they want to know everything that's in it. So they'll read one or two articles, and then they'll save that newspaper because they have this feeling like, I got it, to be, they feel guilty if they don't go back and read the rest, but they never have time to go back and read the rest. So they pile up newspapers until they have 2 rooms or 3 rooms in their house. I know one very sweet, normal gal who had her whole house full of stuff like that, and they actually had to get another house for the husband and kids to live in. And she'd come and visit and take care of the kids, but she'd have to stay in that house that had all the stuff in it. But now with the internet, there's really not much excuse for saving up magazines and newspapers. You can look up anything, and pull it up. And I want to say something else about the conspiracy theorists, because one thing, I went to Duke, and one thing we learned at Duke is just because somebody thinks people are out to get them, it doesn't mean they're paranoid. Sometimes some of those conspiracies end up being true. So there are people that are conspiracy theorists that go way off the deep end with it, and then there's other people though that are there's so much crap being told us in the media and everything that there's some people that have some legitimate suspicions of corruption going on that some people would think were conspiracy theorists that are just insightful. Right. And so there's we don't want to make it sound like all one way or all the other, but there are people that just, the moon's really really is blue cheese. I'll give you an example of someone. So this is you'd never know. That's the thing. These are hidden illnesses. You'd never know. Stable job, been in for a long time, married, kids, all that kind of thing. And I got a lecture on how the Earth is actually way bigger than what we know it to be. And all of us, the entire planet lives in a crater. And so this is what I was being told. And that flat Earth society.
Yes, exactly. And I sat there and I'm listening, and he's telling this with just a fervor and passion. And, he's discovered something. And I think, my goodness, I thought while I was listening, I didn't think anything negative or judgmental. I just thought, what is the psychological mechanism for someone believing that and needing to believe that? There's something, there's trauma, So talk about that piece, the trauma, where that, because I have some friends that were, in the Gulf War, and they have become hoarders, and it stems from the trauma that they suffered.
Yeah, we'll get into that. Yeah, as far as the Flat Earth Society and stuff like that, and people were just faking going to the moon. The world's really flat, and blah blah blah, and I mean, I know a couple of astronauts. I was the team doctor that went on a mountain climbing expedition with Jim Irwin, the astronaut, and I know that he went to the moon and back, and he wasn't faking it and all that stuff. But anyway, let's talk about some other forms of hoarding, because you brought up one. There's people that don't have OCD and don't have hoarding, and then they have severe trauma, like the one you mentioned was in a war, right? And he saw people get killed, and sometimes they see their buddies. I've had patients like that, and they saw their buddy get their head blown off, by these big guns and stuff, and they've had severe trauma. And when people have severe trauma, then it's so painful to look at that they'll have flashbacks of it, and they'll have nightmares about it. They'll have panic attacks. They'll be so sensitive to sound that if you snuck up behind them and clapped your hand, even, they would jump. And I had a good buddy. I was in a bridge club, back in the old days when people used to play bridge, and I was in a bridge club with a guy that was a war veteran, and he had a little bit of PTSD still, but he was fine. He was over most of it. But one time we went in the kitchen to get a snack in between hands, and went to get popcorn, and I was standing behind him, and I had one of those metal popcorn containers, and I accidentally dropped it on the floor. And the second it hit the floor, he was on his hands and knees on the floor. He just jumped down, and he was on his hands and feet looking for the shooter, and then he realized what he had done immediately and got up and explained, "Oh, that's just, I still do that from the military days," but people that have severe trauma will become obsessive compulsive to an extreme temporarily, and that, which could include hoarding certain things too. And remind me to get to another thing we ought to mention, is why they hoard specific things, because there's probably reasons, but I don't understand what they are most of the time. But anyway, they'll hoard something or another, and have all sorts of compulsive rituals and things. But in that case, I think it's like what you were talking about earlier, Kristin. I think it's to keep their mind off the painful reality.
Yeah. And
yet, to cure them, what we do is we have them actually relive the things that happen, and maybe talk to the shooter and put an empty chair in front of them and pretend like the shooter's there that shot their buddy, and tell them off and tell them how they feel, and when the more we go ahead and expose them gently on medication so they can bear it, we put them on a serotonin and an antipsychotic medicine, both, and so they can handle it, and then have them look at the stuff. The more they see it and look at it and handle it, then they get back to normal again. And we've got somebody that's been in our day program and just recently, and left not too long ago, who was like that, and he had, but in his case, he wasn't born with obsessive compulsive disorder, but he had severe abuse from parents, like severe beyond what you've normally heard, just really severe abuse his entire life. And finally, in his late 20s, he's broken free from it. And but it took us a couple of months. Usually people stay in the day program 3 weeks, but it took him a couple of months of digging and probing and crying and grieving, and now he's just doing great. He's totally normal and got a nice new job, and independent, and self-supporting, and dating, and he just he just left a few months ago. So So it's real rewarding, but it's temporary for people that have severe trauma.
Right. And I think of that like when it's trauma induced, let's say, it's like there's a wall, and the wall is all of the stuff that you're hoarding. And the only way to get to the pain is to start. That's why hoarders become even violent, at people that come in to try to help them get rid of their stuff.
Yeah.
Because
you can't do that.
The pain is on the underside of that wall.
Yeah, there's a reason. And like you said, what's the pony in it for you?
Exactly.
Yeah. Now, why though, Kristin? You can probably help me with this. In spite of all the years that I've been treating this, over 40 years now, I still don't. I mean, at least half the time or more, I don't understand why. Like, why did that gal hoard dirty underwear? I don't know. I don't know.
I can
dirty dishes and stuff.
I can understand that because I've had my times with depression and that kind of stuff. Not to that degree, but my life became temporarily that way, and it's really
that makes sense.
It's so much to unearth what's really going on that you literally don't have the emotional or physical capacity, and you don't have the physical capacity because you are a swirl of out of control emotions inside. And so the thought of having to wash your underwear and put it away is like trying to climb Mount Olympus. It's just easier to go buy a new pair, and part of it is self-punishment. In many ways it reminds me of some of the behavior like anorexia or bulimia. Like, this is the thing you control, your mess.
Yeah, even though it's killing you.
Exactly.
I'm embarrassed. I'm embarrassed that I hadn't thought of that, because that's so obvious that when you're real depressed, you're not functional. You can't
Absolutely.
take a shower when you're real depressed.
Absolutely.
And so even though there's depression, even though their depression, they don't show it. They hide a lot of it. It's there to the extent.
It's an enormous amount of emotional and physical energy to hide all of that. And
you just solved that one that I've been seeing 6 years.
Well, the newness of the new
underwear. It's so obvious. It's so obvious, and I just overlooked that. It's obvious.
Well, think about it this way too. Like the newness of buying the new underwear is like, oh, here's something. It's a panacea. Here's this thing that's new that I'm trying to treat myself in some way or another. By doing that, there's all kinds of. I get it. I get it just because I've been there.
I can see that. That's very good. That's very good. And now with Amazon, you can order 20 pairs for $2 each and have them delivered to your front door. And that night, or the next day. Okay, now solve my other one then, because I've never been able to figure out the guy that I have who saves boxes, and it used to be boxes of cereal. I forgot what he saved in childhood. There was something else. But then when he first got married, he used to save boxes of cereal when they had kids, because he was so afraid that they would run out. But then it would spoil because they couldn't possibly eat that much cereal. And then he saved boxes to the point and when I'd ask him why are you saving all those boxes? Well, we might need one. We might need to ship something or something. So you can go buy one for cheap now. You can go. There's box stores. My wife goes to a box store when we need to pack a bunch of stuff and buy some. And I don't know, and he really didn't.
Well, the box
we never did figure out why.
The box
must represent something.
And it's something from childhood that has to do with safety. I mean, I can understand the cereal because cereal is. I mean, there are restaurants that are dedicated to you just getting to go in like a yogurt shop and having all the cereals you love, Lucky Charms and Captain Crunch, where that's like a whole, yogurt shop type of restaurant, but it's all about cereal. So there's so much associated with good childhood, memories around that. It makes me think of people that have dissociative identity disorder, where they, it's something where you're obsessed to, it's tied to an object. The obsession is tied to an object, and so you're completely dissociated from yourself, but your sort of your piece of yourself is now tied into this object, and that's how you feel a closeness to get back to yourself, even though that is not, you know what I'm saying? It's not.
That's pretty
people
deep.
People who hoard teddy bears or dolls or whatever, like they're crying. That's why I always look at people like this.
Maybe they're taking care of their inner child or something. Maybe they're trying to.
Absolutely.
This person that hoarded boxes until he got on the right meds, and then he quit. But in his case, I don't think it was all genetic, because he did come from his family was relatively normal, but they were, well, I mean, what's normal? Normal's only a setting on your dryer. But they didn't show him a lot of love. And he grew up, wanting to love and be loved, and then it was pretty mechanical family. And in fact, he dated a gal that they didn't like when he was in high school, and they told him he couldn't date her anymore. And then they found out that he secretly dated her. They didn't speak to him for 2 years. 2 years. They didn't speak to him because of that, because he violated their will. And so he was controlled. He was firstborn, and we know that firstborn are more perfectionistic than other children on the average. 15 of the first, let's talk about astronauts, 15 of the first 16 astronauts were firstborn sons. Now, is that a coincidence? See, I don't think that's a coincidence. I think when you don't have kids, you tend to expect too much out of the first one. And so they grow up perfectionistic, like no matter what they do, it's not quite enough. So they succeed the most, but enjoy it the least, unless they get therapy and learn to, be, which the couple I've known, I knew, actually I met two of in one female, and they were very normal people. But firstborn would have more likelihood to be hoarders psychologically, and a lot of, if you know people that save antiques and have antique stores and things like that, it's not right. Don't go around thinking that they're crazy or anything. They're not crazy, but ask them if they're the oldest child of their sex in their family, and I bet 90% of them are the oldest boy or the oldest girl in their family. Just like people that are speech therapists, ask them, and about 90% are the oldest child. I don't know why, but I guess because they want to help people speak just right and things. But people that are real successful, lots of times it's more likely. I'm not firstborn, but and I'm not the oldest boy, but my brother, who was more of a perfectionist than me, for sure. And so some of it's, in his case, how much of it is from being firstborn, how much of it's from being in a family where he didn't get enough affection, and he got too much being controlled. So by hoarding, he's in control of something.
Right, and, exactly.
And the cereal was nurturing himself.
Yep.
Maybe the boxes are so he can move out of his home. But he ended up meeting a great wife, and he's a good dad, and he's got a normal life and normal kids and everything. He's a great guy. I really like him, and I still seem to make sure he stays on his medicine. That's something else. People that have lifelong hoarding, if it's due to psychological reasons, then therapy does help them overcome it, and they probably won't need medicine the rest of their lives. But those who have a genetic tendency toward it, or if it's purely genetic, and they may have a real normal family, and the other brothers and sisters are normal, and mom and dad are normal and everything, but they're the only ones that have it. Well, they inherited it from somewhere, some uncle or something. They need to stay on medicine the rest of their lives. And like I say, I can get anybody over hoarding or OCD within a couple months. if they'll take the medicine. And but if they take it till they're 80, and they're OCD free and hoarding free from age 30 to 80, then they quit the medicine. They'll go back to it within a month or two. They won't be able to stop it.
Yeah, and that's where I always think of neurons firing, and we try to help ourselves when we go back to things that are unhealthy because of our medication lapse. I mean, so people have there is a stigma around, oh, they've fallen down in life, or they've somehow you've gone backwards. And I always try to explain, no, these people are freaking champions, because yes, they're not taking their medication, and hopefully they will go back to that, but their body is trying to help them, get better. It's doing it with a handicap even. So these are athletes, these are not lazy. You have no idea what's going on inside that person to see how much mental anguish that takes up physical energy too, that they're trying to control during those times when you're not medicated.
Yeah.
Awful.
Yeah. And I've got a national chain of psychiatric clinics around the country, and I'd say 75% don't get any medicine at all. They just get counseling because they're going through, a temporary crisis or marital therapy or things like that. But about 25% need medication, and maybe out of those, or maybe 30%, but about half of those are from genetic things that are lifelong, and half of them just need temporary medicine for a year or so, and then they don't need it the rest of their lives. But some people, if they inherit OCD which is hoarding can be a form of OCD. It is a form of OCD, but if they inherit it, then they'll need lifelong medication, usually double the normal dose of the serotonin medicine, and sometimes they need a little bit of dopamine medicine added to it to finish the job. I got another guy that just came to mind that I've been seeing for a long time that, it was just horrible for him. He had rituals, and he would hoard Bibles and religious books and things like that. And he had to lay on the floor and do rituals and say long prayers and beat his head on the floor practically and stuff. And it took me about 9 months of trying medications, convincing him into taking them, but then trying different ones and then getting up to the right dose. Then we'd get one that worked, but he really would have legitimate side effects, and we'd have to change to another one and start over. And finally, after about 9 months, and usually, like I said, we could do it in 6 weeks, but finally after 9 months, he got on the right dose of the right combination, and he's been just totally normal ever since for a couple of years now. And doesn't hoard and doesn't have the OCD and doesn't have to do any rituals. And it was just all genetic stuff. But if he quits the medicine, 50 years from now, it'll come back.
It'll come back, exactly. Oh, well, Paul, I love that you wanted to talk about this topic, because you're right. Of all the things for all the years now that we have done shows on, I can't believe we've never...
We found a topic that we hadn't talked about.
It's amazing to me. And I was thinking about this yesterday, and listeners, I'm going to share this with you too, but I have done so many shows, and I just don't get excited like I used to. There are certain people I want to talk to, and if it's new material and whatever, so I'm not doing as many, because how many times can I talk about bipolar disorder? And everybody that wants to come on, they've figured it out. And I just can't, I don't want to dampen someone else's enthusiasm at all. And they're certainly credentialed and I'm not, but I can only do, and that's just an example of a topic, but I really only want to talk to Paul and a couple other people, and that's it.
Well, I appreciate that. And you gave me some insights. You showed me something that's so obvious that I should have seen it 30 years ago, that of course if they're hoarding, they're probably, even though they may not show their depression, they're probably having trouble. I mean, because they do good work, so they're putting all their energy to work. So when they come home, they just don't have the energy. Some of them that do that don't have the energy to clean the house. They don't have the energy to wash their clothes. They don't have the energy to do that because it's just they're non-functional. And I want to mention one more thing. I want to mention one more thing before we quit. For those of you who are parents, if you have a child with that has to, they have to line up their 40 toys in a row, and they have OCD type things, or they hoard to an extreme, then be sure you get them help, because it's a shame to have them go through life like that when they probably inherited it from some uncle or aunt back there, or great grandma, and they could get on a simple medicine like Prozac and live a totally normal life. It'd be a shame. Or if you have a child that's been really healthy and normal, and an athlete or a leader or cheerleader or whatever, and they've lived real successful lives, then all of a sudden at age 17 they start hoarding or having other compulsions and things, then it means either they've had a trauma that they're not telling you about, or it means that they may have inherited something like schizophrenia, or they may be getting psychotic for some other reason. And because if somebody's about to break with reality, they often will become real obsessive compulsive for about 2 months, a month or two, and then they'll have the break. And it's their brain hanging on to sanity. They become obsessive compulsive, so their brain can hang on to sanity. They can avoid looking at the crazy things they're starting to think and stuff by doing the compulsions or the hoarding. And so get them to see a good psychiatrist, and he can put them on medications. And even if somebody's inheriting schizophrenia, which 1% of the population inherits, but they have totally normal families. Now, it's not caused by the family; it's caused just purely by genes. But if somebody's inheriting schizophrenia in their late teens, or it's usually in the teens or 20s, if you make it till 30, you're probably not going to get it. But if they start becoming real compulsive, and they get on a atypical antipsychotic medicine, that's a dopamine medicine and maybe a little bit of a serotonin medicine, then if you inherit it, you got it. But they can be so normal that they have normal jobs, and I know people with schizophrenia that have become pastors and doctors and have normal jobs if they stay on a medicine that keeps them in touch with reality. And again, if they do great until they're 70 and then quit the meds, they become psychotic again.
Right.
And so
exactly.
If you need meds, take them. If you don't need them, don't take them. But if you need it, don't be afraid to take it. It's not going to control you. It gives you control. I told 2 people in the day program this week that got on life-changing medications while they were there. I'll make up a name. I'll say that said something like John, meet John, or Sally, meet Sally, the real Sally.
Right.
And I've had 2 people in the last couple of weeks that said, this is the best I've felt in my entire life. I said, well, this is the real you that you would have been your whole life if your parents would have given you something to correct this chemical imbalance.
Right, exactly.
That's my parting thought. If you have kids that are suffering, don't be afraid. Don't be embarrassed. It may have nothing to do at all with the way you brought them up or anything. It can be totally genetic, and it is maybe 20% of all things that we treat as a psychiatrist are purely, they're almost entirely genetic.
I know. If I would have said yes, and I don't blame anybody at all. There was so much stigma around medication. I mean, they wanted me to be put on an antidepressant when I was 16, and I said no, and it wasn't really enforced, and it probably should have been. I mean, it should have been. I would have had a whole different experience in my life, and I don't look back at that with regret or why didn't they. There's no anger there. It's just a fact that things, would have been very different for me, because I do have a chemical imbalance. It's just the way that it is. I mean,
and I do.
I don't feel ashamed. I'm not ashamed about that at all. That's just,
I'm not either. That's why I talk. Not very many psychiatrists talk about their need for psychiatric meds on on a podcast,
You
but
do, and
I do
love
it.
that.
I do it to help people. I don't care if they know. I mean, I'm doing fine. If I was any happier, I'd feel guilty. And so I live a happy, normal life thanks to medications. And I mean, you have to do happy things to have a happy life. It's not like it makes you falsely happy. That's a wrong impression people get too. If you take an antidepressant, it doesn't make you any happier. If you're already a happy person, you don't become a happier person. But if your chemicals are low and you're depressed because your serotonin's low, and it helps you hang on to your serotonin, then you become your normal amount of happiness. You're just you. You become you. Yeah.
Exactly. You still have to work at it. It's still a muscle that you have to exercise in order to keep that level up. But at least you're not starting from a deficit that's, because of that chemical imbalance. So, yeah.
Psychiatry meds just help you become yourself. Exactly. They help you become the real you without the chemical imbalance.
Exactly. Well, Paul, thank you as always. I love doing these with you, and I want to thank our listeners for tuning in to another episode where we're talking about an all too popular topic now, and hopefully we'll have more sensitivity towards it, which is hoarding.
We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.
All right, Paul, that was awesome.